that low-hanging fruit, like magnesium, vitamin D, some of these more simpler vitamins, I remember reading about during the pandemic the absolutely chronic deficiency of specifically vitamin D in the American population. And I guess this kind of opens, this may be a little tangential, but I think it's pretty interesting. This idea of like preventative care. And I think your test and what you do somewhat falls into this field of like, I feel like American healthcare, I know that's a big term, but is a lot about treating something or treating a disease or treating something that's already taken place when you have symptoms, when you have stuff going wrong, and it's not very focused on actually getting ahead of things. And when you look at just cost differences between finding, the easy example is like finding cancer early is just a massive difference in terms of cost and positive outcomes. Do you think that your test can fit into that? And I know it's a big topic, but what do you think about that?
Yeah, I agree with everything.
Yeah.
I guess to expand and like echo what you're saying, Nate, is the healthcare system in America, it's a sick care model, right? They want money from you, essentially. However, we are trying to change that paradigm into a wellness model or like a healthcare model, right? A true healthy society. What happens is by preventing aging or slowing down a lot of these age-related diseases, you're putting in the money, you're putting in the time, you're putting in the effort. Now, by the way, I don't think your health should ever have any type of price tag on it. I mean, you have to be reasonable, you have to be able to live, but I think that should really come first in terms of, you see a lot of people nowadays spending $500 at the mall and it being like nothing, right? But when they buy a vitamin D supplement off Amazon that's $30, they freak out or they second guess it, right?
Yep.
And that's not okay. So yeah, my point in going on this, again, rant or tangent, I guess, is that we need to be proactive. We need to do this testing now because like I mentioned, if you identify that you're aging quicker and you take action now, you are saving yourself maybe 20 years in the future from developing type 2 diabetes, right? And then paying all of the money for insulin, right? You will save yourself money if you invest in yourself and if you invest in your health now. Same thing with like mental health, right? There's a huge stigma around mental health, stress and, kind of the grind and us Americans kind of just putting our head down, going to work, not talking to anyone, then leaving, then, going watching TV and going straight to bed, right? That's not normal. You won't see people in Europe doing that, or even Canadians really doing that same process throughout their entire life. So I think the entire world needs to really take more of a holistic approach, a functional healthcare approach. And I think it starts with availability, right? A lot of people don't know that this type of testing or these type of functional doctors is even available. I didn't know once. I only knew because I was very lucky that I got that position after college and was kind of exposed to this entire space. But a lot of people don't know that, healthy care is available.